Well, great. Thanks, Dr. Ashkenazi. I mean, feel free to turn your, I don't know whether you're in a situation to use a camera, but feel free to turn it on. And, we're just going to open it up for Q&A. And as individuals consider their questions, we did have Dr. Eli Ashkenazi join us as well. And so in addition to Dr. Bozzio, either one of them would be happy to answer questions. And there were a couple questions that came in right towards the end when we were making the transition, and I just wanted to make sure that we responded to those. I think one was, and I think, Tony, you did comment on this a little bit. How did you sell or position the new product to administration? And that can probably be a corporate question as well as a surgeon question. But from a surgeon standpoint, what are your thoughts?
Yeah, when this came up, I was thinking that it would be a fight to get it, but it wasn't. For some reason, it never was an issue. So we looked at the pricing and it wasn't bad at all. So that was, I think, part of it, but it just didn't become an issue, even for the ASC. So we'll use them there too. And that it just opened. Otherwise, I'd be using them already.
I was just going to say, from my standpoint or our standpoint, our experiences when we have a surgeon that is willing to champion, they like yourself, that's willing, to kind of carry the ball, and they see the advantages to their practice and to their patients. We've had, good success rate at getting it in. As working as a team along with the distributors. So, and we've got tools, cost savings that can be recognized, benefits that can be seen, and the surgeons can use that, if they get to a point where they're presenting. But yeah, in your particular case, it was quite smooth, and we appreciate that. Go
ahead. And I'm not sure about navigation. I've never used it navigated. I don't know about, I'm almost positive there's not a robotic platform for it yet. And I don't know about BrainLab or 7D or any of those. Has anyone else used it in a navigated setting? Or I think like Stealth worked.
Yeah, I'd like to open up Yossi, feel free, or Dr. Ashkenazi. I know the particular case that we showed was over in Israel. I know there's been some interest. But or Dennis, you as well, feel free to jump in if you have any comments.
I asked the companies if it's accurate enough, because it's a curved tool. Even though it was used a few times in Israel, I didn't use it yet with a navigation system. What they said that they don't think it's accurate enough. BrainLab are not at the point that they like to try it. They're still they're trying to progress with their instruments. The same thing is with Nuvasive. Mazor Robotics had some interest about it, but since we started with all this Corona stuff, I'm not hearing from them yet, but they were interested to try and get it into their system.
Thanks, Dr. Ashkenazi. I know, for all of you, I mean, this is a unique technology, and it's continuing to evolve, and it has evolved over the last few years. And our corporate engineering team, along with Yossi, Dr. Ashkenazi, continue to look at different applications and what the evolution may be, and with input from surgeons like Dr. Bozzio that have been using on a more regular basis. So, and that's how the bayoneted instrumentation was created, based on that feedback and the need from the field. So, yeah. I'm sure there'll continue to be an evolution.
This is Cindy Griffin. I just wanted to make a comment with some conversations that we've had most recently with some US surgeons. Currently, the Medtronic or the Stealth system, we're not going to be able to register the instrumentation with that system. I don't know if anybody else has a comment on that, but.
This is what they say. This is the reaction. This is the same answer I received from them, but I know that there is a surgeon in Israel that used it with the Stealth system. I don't know how accurate it is, but he managed to do the job without any problems. So, but it was never tested and never got any, official registration or anything, just a trial of a single surgeon. But I think there is a room to to progress with it. And as I see it, this is a tool that probably will have a lot to do in spine surgery, but it's still work. There's still work that can be done to get to have progress with the abilities of the tool to achieve more indications using it for spine surgery.
Yeah, agreed.
Yeah, and I would just add, this is Dennis. We have had a lot of speculation on this topic. Surgeons that have come and asked about it, those that use navigation or robotics. And at this point, there's a fair amount of R&D in front of us and on the part of, a robotics or navigation company in order to marry these technologies. But the potential is there. There's a fair amount of excitement because today, as we all know, these robotics and navigation platforms are really just drill guides. They kind of line up your drill guides and help you deliver hardware in a more timely and potentially more accurate manner. But, what's super exciting is, how about the decompression and being able to, position a tool like this in an area and add the additional layer of protection of the shield. It's really got a lot of potential, but as Dr. Ashkenazi says, a lot of work in front of us on that. So we shall see.
Yeah, I could see something where, with the robot, you could get into a situation where you could pre-plan your trajectory to pass out the foramen and then turn it on and it would guide directly where you want it to go. That would be amazing. I think the other device we talked a little bit yesterday about this was what's the difference with the Misonics and the hook that they have. And that really is just a little, it's only a couple millimeters. So it's not really like a curved device. It doesn't get as far out there. It still leaves you with the limitation of a straight device. And I'm not sure that the device that device will allow for such a long arm, working arm to curve out a foramen like that and still have the ultrasonic capability to remove bone. So that's kind of another question and another thing, but I used to use the little hook. Now I don't. I just use the blade and then I go right to the Dreal. So.
But while we start to wrap up, I did want to thank Dr. Bozzio for joining us this afternoon. And yeah, thank you very much for your comments and sharing your experience with the technology. And Dr. Ashkenazi, we appreciate the opportunity to have you join us as well. So thank you so much. Just a couple more minutes or maybe about 30 seconds here. We'll give you an opportunity